Hello, my name is Aaron Dangle from waiverprovider.com and Florida Unites. Here with me today I have the Secretary of AHCA, Elizabeth Dudeck. She's going to answer some questions and try and clarify a few things for us. Thank you very much for meeting with me today. How are you?
Welcome, Eric. Aaron, I'm fine.
Good. And let's see, to start with, can you tell everybody about yourself, your background, and what you do at AHCA?
Okay. Just as a background, I've actually worked for the state of Florida for approximately 33 years and began working with the developmentally disabled when I came to Florida. I worked at what is now AHCA, but was Gainesville Sunland Center. And when I came to Tallahassee, actually worked on the closing of what was then Tallahassee and Orlando Sunlands, to help move people into the community, and have worked in various positions along the way. Most recently, I was Deputy Secretary for Health Quality Assurance, which is responsible for all of the regulatory and enforcement activities of the agency, both on a state and federal standpoint. And as the Secretary, I try to guide us through making the best public policy, effectuating what we need to do with regulation of healthcare facilities, trying to spend the Medicaid money as wisely as possible, and then leading the agency to work with other agencies within the state, and as well as consumers and the providers in the state to get the best healthcare facility that we can.
Well, first question, how many home and community-based waivers are there? And can you tell me a little about each one and who it serves and what state agency to apply to for these different waivers?
And Aaron, I think I told you I probably have some notes, and so I'm going to try to read from some
fine.
of those because I'm just learning some of them, and I'll give you website contents or contacts at the end so that the people you represent can go out to the website because there's a lot of information there. We have approximately 15 home and community-based waivers. Many of those are with other state agencies, Department of Elder Affairs, Agency for Persons with Disabilities, the Department of Children and Families, I believe the Department of Health has one, and then the agency has several. The adult, if we go through agencies, Elder Affairs has the Adult Day Healthcare Waiver, which is basically what it is. It's an adult day healthcare, and it's in Lee and Palm Beach counties. It also has the ALE waiver, assisted living for the elderly waiver, which is one of our larger waivers, and it represents and serves a population which is individuals 60 and over. It's statewide. They do case management, assisted living, and incontinence supplies. Also, Department of Elder Affairs has in the Miami-Dade and Broward County areas the channeling waiver for individuals over 65, case management, and 20 other different services that are provided. The nursing home diversion waiver, which is one of the largest waivers, is for individuals 65 and over with representation in 33 counties around the state. Actually, will be interesting because it will be one of the bases, if you will, for the long-term care managed care waiver, because it is a managed care program at this point in time. They basically provide case management, 20 other home and community-based services, acute care services, unlimited nursing facility services, etc. So there's a lot within that. There are some smaller programs, but I'll try to hit some of the larger ones. The Agency for Persons with Disabilities has several developmental disabilities waivers, which provides basic Medicaid services, and then about 28 different additional services, and that's done on a tier system through that agency. They actually have some individual, they're going to the iBudget waiver,
Right,
which is another movement, similar services being provided. The Department of Children and Families has the Age and Disabled Adult Waiver, which is for individuals who are basically 18 and over, and provides case management services and about 25 other home and community-based services. At the agency, we have a couple of smaller programs. I can't even name one of them in terms of it. It has a specific disease type that it deals with, but we have Project AIDS Care and Model Waiver, which provides services for specific types of categories of individuals with certain needs. And then the Department of Health has a traumatic brain and spinal cord injury program, which serves individuals suffering from this.
thank you. And another one, can you explain the step-by-step process of how to get a wheelchair when you have Medicaid?
Step by step. I would say one of the first things I would do is probably call our local Medicaid field office to get the exact what do I need to do, so that we make sure that that's covered under whatever coverage that the individual may have, and to go through the process as quickly. Typically that type of service would require an order from a physician, as do most services, and then, hadn't anticipated this question, but that then they would walk through who the designated providers could be that you could go to, what type of wheelchair was available, and work through that system. I'd have to get back with you on more detail, but I'd always go to the field office for questions.
When I interviewed Holly Benson, one of your predecessors, we discussed how difficult and time-consuming it is to get a provider number for an individual. I still have providers complaining sometimes that it takes anywhere from 6 months to a year or more to get a provider number. Also, once providers actually get a Medicaid number, they have to sign up with each separate district at the Agency for Persons with Disabilities. As you can imagine, this is a very long process. With today's technology, isn't there a faster and easier way to do this? And when I spoke with Holly Benson about this, she said that I should present a suggestion, and I actually do have one. The Florida Department of Education does an online enrollment for teachers. It's very nice, very easy. Their system keeps track of everything that a teacher submits and provides alerts for step-by-step things that they need to do to finish their enrollment. At any time, a teacher can go online, look at their status of their application, and see exactly where they stand. Couldn't we model something like that for providers?
And that's something that we're trying to do. I know one of the areas that we want to make improvements is in application processing. Not only the education to the provider on how to complete an application, because the biggest problem is that we get incomplete applications. And then there's a back and forth and a back and forth, or people have fingerprints that don't take, and so it takes 3 tries to get a fingerprint done. Working with our other agencies too, what we're looking at is how to simplify. If we can get down to 1 application, I think that might take a little bit and some changes, but how we can get down to 1. I know that there is an ability to get online and apply, which I don't think a lot of providers know about, so we need to make that information more apparent and more readily available. And we're looking at how to utilize things like background screening, because we do license providers as well as sign them up for Medicaid, how we can use that information, and there's several work groups that are directed at doing that. So your suggestion was great. We're trying to move forward that way. In some cases it takes a little bit of funding additional to help us get there, but great suggestion, and that's one of the things we're trying to do is make it easier.
Okay. Now, I've also been told that Cover Florida is no longer going to be offered to people who need health insurance. However, on July 1st, 2011, the new PCIP, pre-existing condition insurance plan, became available. Can you explain that program and how someone can get insurance through that?
Sure. My understanding of that program, which was part of the Affordable Care Act, was that it will provide health care coverage for individuals who either did not have coverage for at least 6 months and had a pre-existing condition, or who have been denied health care coverage in the past because they have a health care condition that would otherwise have disqualified them. That program can either be operated by the state or actually through the Department of Health and Human Services, which in the case of the state of Florida, it is the Department of Health and Human Services that is running that program. I've got a website that I can give you when we're done where you can direct people to that website.
Well, if you just want to say the web address.
Sure, it's www.pcip.gov.
Now, why is medically needy Medicaid offered only to people who have children? One of my readers is an adult cancer patient who has exhausted her savings and health care policy limits. Since she's not pregnant and does not have children, she was denied for Medicaid.
Historically, the medically needy program required people to be first qualified for Medicaid, and then the issue had to do with either what their income was or what their assets were. And traditionally that population has been 65 or older, disabled, blind, based on SSI criteria, pregnant, or certain individuals with minor children, etc. There were changes federally last year, I believe in April of last year, and because that's an optional program, it would be one that would have to be authorized by the legislature to be added. So individuals could be covered, but they would have to be added legislatively.
Some items are covered by Medicaid, but since the reimbursement rate is so low, nobody will cover them. I recently tried to help a family get feeding tubes, and I know they were covered by Medicaid. I had to call several companies before anyone would agree to cover them. And they admitted to me that they were taking a loss but wanted to help the family. What can be done to make the reimbursement rate more fair so they'll actually want to take advantage of that and use Medicaid?
Well, one of the things that I did, again, it would be good. I don't know who you called, if you called our offices to try to help you, but I'd always encourage people and you to try to do that. I did want to look at, because I didn't know that much about G-tubes and where you could get them, but I did find out that in the last fiscal year that we actually had 158 providers who were providing G-tubes, and we had about 3,000 individuals who actually went through that process. With respect to the reimbursement amount, I mean, that's something that everybody's always working on, and is something that's brought forth before the legislature every year. And I think we're all trying to look at how we can best provide all the services that individuals need and we need to provide, and how we can do that within budget. So
yeah, it's just a shame though that knowing that a family, if they try and call around, they have the possibility of somebody saying, "Oh, we can't do that." But they can, they just don't want to because it's not enough money for them, and they're actually going to take a loss if they do it. So that's just kind of a shame.
And that may be something that with advent of statewide managed care, that there might be a benefit that individuals can, through the managed care programs, get more than they may have gotten before. So that's one thing that we would hope, that access will be improved for everybody and everything.
The Miami Herald did a report on assisted living facilities, which I'm sure you're aware of. People were shocked to learn that assisted living facilities only have to be monitored one time every 2 years. The Miami Herald reported a lot of abuse, neglect, filth, even deaths happening in some homes. Will AHCA be visiting homes more frequently after this report was brought to light? Seems like 2 to 3 visits a year should be a little bit more necessary around the state.
Okay. One of the things that we looked at, and certainly none of what was reported was acceptable at all. They did span a long period of time, and we've taken a lot of efforts, and there's a governor's task force on ALS that's actually meeting here next Monday afternoon from 1 to 4. They're going to meet to look at issues of regulation of assisted living facilities. It is true that by statute we're only required to go there every 2 years. All of our surveys, with the exception of when you first open up, are unannounced, so we can go in there at any point in time. Assisted living facilities basically can be of three types. You can be your plain, if you will, vanilla. You can have an overlay of limited mental health, limited nursing services, or extended congregate care. The latter two require us to go in more often, either twice a year or every 3 months. So for those facilities, we would go in more often. And we actually go into problem facilities where there are complaints, et cetera, much more often. So even though we only had to inspect half of the assisted living facilities, we surveyed or went out probably, I believe we went out twice as many times the number of facilities that we needed to go out to. In terms of the number of visits that we had, were double what the number of facilities we needed to go to. And one of the things that we're going to try to do is focus on problem facilities, so either facilities that have a history of complaints or history of other problems, focus our efforts on those facilities, and where we have facilities that have had a good record, they can go on the 2-year or maybe an abbreviated survey, which the statute allows us to do, but try to really get into the other providers, which if you look at some of the recent activities, and even last year, I mean, there were 23 facilities that we took action to either revoke, deny, or take some suspension of their licenses, and that number's increased this year. So
I'm sure. So just gonna make sure you guys focus a little bit more.
Yeah, and it's something. It is a residential method that has changed over time from someplace that maybe mom and dad would have gone to basically an alternative for a lot of individuals who don't have someplace else to go, that have some needs that could be met. So there are a lot more people, and we have as many beds as we do nursing home beds. Right. So,
and it's also I guess a suggestion's been made to APD about support coordinators going to limited support for group homes. Is that something that you would consider? Because in my opinion, they're kind of the eyes, you know.
Right.
Why would you want to take them away? I mean, it's not something that's in place, but it's just been suggested. And, you know, to me, I believe that that would be one of the worst things that could happen. What do you think about that?
You know, obviously, and I haven't talked to APD about that, but the more that we can use to get into facilities, but that includes people who have family members in facilities, that we ought to do that. I know the presence of somebody watching is always good, even in good facility, because they know that you care, and the person you're going to see knows that you cared. What we're trying to do is increase our efforts with the ombudsman, with our sister agencies, because many of us go into facilities to make the most of those visits, to team up sometimes if we need to use each other's visits, but to try to expand that so we have as much exposure in the facilities.
Right, so the more eyes, the better.
It's a good thing.
Having multiple insurance policies can sometimes be more of a burden than a blessing. Everyone says they don't pay since they are the payer of last resort. In your opinion, who is the payer of last resort, and how does this process of submitting claims work? In which order do insurance companies pay? Private insurance, Medicare, or other Medicaid partners, waiver, or AHCA?
Okay. Well, Medicaid and all circumstances is supposed to be the last payer of the last payer, with actually Medicaid waiver even after that. So you would go through Medicaid waiver at the end. People are directed through their handbooks. Providers are directed to first go to the insurer, to go to any other third party, and then to Medicare, Medicaid, and Medicaid waivers. And again, if people are having difficulties in any way, I would urge them to call our area offices for help.
It's my understanding that AHCA goes out to do audits on providers. Also, AHCA does audits for APD on the providers. Some providers say AHCA does not seem to know all of the APD rules when they come out to do an audit. Can you tell me why AHCA does not also have an APD representative with them when they do an audit on an APD provider?
I don't have an answer to that, but I can check on that. I would think that we ought to have as much information available to us, either somebody from APD if they have somebody available, or just know what standards should be done. So I'll follow up with that, because I wasn't aware that that was an issue, and it's a good suggestion if we're not doing it.
Okay, thank you. There seems to be a shortage of some providers in certain areas. Dental comes to mind. It's almost impossible sometimes to find a Medicaid dentist who will provide sedation. What's being done to recruit new providers in critical shortage areas?
Okay. I think that the issue of specialists, and I don't know that I would have always thought dentists to be specialists, but obviously they are, is a problem nationally, for not only for Medicaid, but for any individual to go out and try to get like a pediatric dentist or something like that. I know that there was an effort this past legislative session where dentists' fees were actually increased by almost 49% to try to attract more dentists. There was also legislation that would direct us to establish, we've got one dental program, prepaid dental program already in Miami-Dade for Medicaid, but there was a legislation that would have us award some more statewide programs. And we did an initial award, which would be followed by a contract to 2 providers to go statewide for prepaid dental services. And they'll be expected to cover everybody who's not otherwise covered within their managed care plan for dental services. So we're hoping between an increase in the fees that are provided, as well as the focus of statewide dental plans, that we'll get more people covered.
I understand also that AHCA is taking a strong stand on Medicaid fraud, and I agree we should not be paying for services that are not rendered. However, in some cases, I agree we should punish the bad guys, but how can we make sure the good guys aren't the ones that are taking the fall? Because, I mean, I seem to see that happen a little bit as well, where, you know, a good provider gets caught doing a reimbursement for such a small, insignificant reason when they're really not doing anything wrong.
Well, we're trying to be reasonable in our regulation, and as you know, there's been a lot of, as there should be, exposure both from the legislature. The chief financial officer has a strike force that I'm on fraud and abuse, and we've always been very concerned about fraud and abuse within the program. Sometimes we run a fine line between Was there intent or not intent? People knowing what is being covered. If they have any questions on how to provide the documentation they need to ask us, because a lot of things are tied up. If we suspect that there's a problem, we will pen payments, and we're allowed to pen payments until we can get the documentation we need. Very often with some of the providers where there was no intent but they didn't fill things out correctly, we have a back and forth that will reduce whatever is actually found, get them back on track. One of the things that we're going to try to do is do reconciliations in a more frequent fashion, so that we will be telling, especially new providers, hey, look, you're not submitting that correctly. Did you mean to do this or did you mean to do that? So that we don't run into problems, so that we don't run into several years of a problem existing. And that's one of the things we're working on from now forward.
And back with the other question, and if an APD representative was with you when you guys were doing the audits, it probably would help a lot with those types of situations.
Yeah, and I'll follow up with that. That was a great suggestion.
And kids who are on the waiting list, those parents do not meet the income requirements, cannot get Medicaid. What else is out there for them if they don't have insurance? Would they qualify for kids care, medical service? Can you tell me about those plans, and do those plans also cover diapers and personal care assistance?
Okay. And I was actually at a Kid Care Coordinating Council earlier this week, so every time I learn a little bit more about the different programs. We have several programs. Healthy Kids, Medikids, Children's Medical Services, and if you don't mind, I had to get a little bit of data on what each one does, but basically they will cover uninsured children with family incomes that are above what typically would be covered by Medicaid. Medikids provides Medicaid benefits, except waiver services, and uses our provider network to access services. Healthy Kids provides also a comprehensive medical and dental benefit package and services through our managed care providers. And Children's Medical Services provides benefits through a network of providers for special need kids. Medikids and the Children's Medical Services cover diapers and personal care assistance. But again, there's more information that we can get you. For instance, Florida Kid Care, if people want to go to that website is www.floridakidcare.org. Find out what's available there. But there's quite a bit. I was impressed with how much is out there available for children.
Good.
Of all income levels, basically.
All right, and I've spoken with social workers, support coordinators, hospital discharge planners, who say often they find themselves confused by all the rules involved to get certain Medicaid services. If it's difficult for professionals that navigate through it all the time, can you imagine, it's next to impossible for somebody without a professional to assist them to navigate the systems. Where can a family member go for answers to these?
Okay. Again, I would recommend that they go to our area offices, and that's a longer website, but I will get you that we can provide to everybody out there, in a listing of the individuals within our Medicaid offices who, as I've visited them, I see individuals who come in basically to find out what's available, what they need to do to process, to get a wheelchair, etc. So I'll give you that information, but I would definitely go there, and if they don't get a result doing it that way, they can always call me, and I'll make sure they get somebody to call them and follow up.
Good. Well, I do thank you for taking the time to answer a few of the questions today, and I'm sure we'll be talking more.